Hi, I'm Dr. Seth Baum, the immediate past president of the American Society for Preventive Cardiology. And we're here today at the American Society for Preventive Cardiology Congress in San Antonio, and it's going well, I'm very happy to say. Last evening we launched our Health Economics 101, a must for the modern clinician town hall series. And it's a series we started because we understand the importance of clinicians having a better grasp, or a grasp, because we really don't know anything about this, about drug valuations or health economic evaluations. How do we look at a given medication that's being introduced into our care and say, is it a cost-effective medication? This has become very important since 2015, when most of us were living in our very comfortable cardiology lives and prescribing medications and therapies for our patients and never having pushback from the payers, and all of a sudden PCSK9 inhibitors, what I think are the greatest advance in lipid-lowering therapy in 3 decades, are released in the summer of 2015. We start prescribing, and lo and behold, our prescriptions are being denied by the payers. This was new to us. We had to learn how to navigate the prior authorization system, which was very burdensome, and frankly, we've been struggling with this for the last several years. The ASPC responded by constructing a town hall series to educate clinicians across the country, by publishing papers, by creating a single-page prior authorization. So we've done all these things to address the problem. But now 2018 rolls along, and in our cholesterol guidelines, we have drug valuation as actually part of our guidelines and part of our decision making. Now, the interesting thing that occurred was that PCSK9 inhibitors at the time of the release of the guidelines dropped their price 60%. So what did that do? Well, it basically made the valuation that was embedded in the guidelines obsolete. The day they were released, that valuation was obsolete. So when we now consider the decision to initiate PCSK9 inhibitors, since they were a little bit blunted, that initiation, because of valuation, we have to get rid of that. It's no longer valid. Now, this is not just in the land of PCSK9 inhibitors. It cuts across all therapeutic territories into our diabetes, which is a very important aspect of cardiovascular disease prevention, in the anticoagulants, drugs for heart failure. All these drugs are facing valuation issues. So we need to learn what an ICER is and what a QALY is, and how to incorporate these into our practice, and how to be sure that we're prescribing medications appropriately for our patients, for the appropriate patients, but we're also not letting payers push back when it's inappropriate for them to do so. So please go on our ASPC app and look at the Health Economic 101, a must for the modern clinician, and you can see the slide deck and learn, and I wish you the best.